Did you know that by age 65, nearly 60% of adults experience regular foot and ankle swelling? But here's what's truly remarkable. In certain regions of Japan, elderly people report significantly less edema and foot discomfort. Not through compression socks or hours of elevation, but through simple, deliberate movements practiced throughout their day. If you're over 55, what you do in short moments throughout your day could determine whether you maintain comfortable, non-swollen feet, or join the millions who suffer from painful edema and limited mobility due to swollen lower extremities. I know that sounds dramatic, but this isn't about fear. It's about opportunity. Because these 6 traditional Japanese movements could literally transform your foot comfort in days. In this video, I'm going to walk you through the first of 6 powerful circulation-enhancing movements that Japanese elders have practiced for generations to maintain comfortable, non-swollen feet well into their 80s and 90s. And the first one, it's not elevation or compression. It's actually a gentle ankle pumping technique that looks simple but activates your venous return faster than hours of putting your feet up. Most Western doctors completely overlook it. And make sure to stay till the end because I'll share a bonus tip about timing that most edema experts never mention, but it could double the effectiveness of every movement you do. Exercise 1: Ashikubi pumping. The ankle movement that activates venous return. What if I told you that one of the most effective techniques Japanese elders use to prevent foot swelling isn't keeping their feet elevated, but a simple rhythmic ankle movement that can be done sitting at a desk, watching television, or even during meals? Ashikubi, ankle pumping might look like just flexing your feet, but what's happening in your venous circulation while you're doing it is remarkably powerful. Ashikubi pumping has been called the invisible circulation booster, and for good reason. According to researchers from Kyoto University's Department of Vascular Medicine, rhythmic ankle flexion and extension activates what's called the muscle pump mechanism, enhances venous valve function, and most importantly, dramatically increases blood return from the extremities back to the heart. That means it actually helps your body overcome gravity and poor circulation, especially in the veins that struggle to push blood upward against gravity as we age. These are the very same vessels that, when functioning poorly, allow fluid to pool in the tissues around your ankles and feet, creating uncomfortable swelling and tightness. In fact, a 2018 study from the Journal of Vascular Health found that adults over 60 who performed ankle pumping exercises for just 3 minutes, 4 times daily, showed a significant reduction in ankle circumference measurements and reported greater comfort when wearing shoes, especially in the evening hours. But the benefits extend further. Ashikubi pumping also improves lymphatic drainage, enhances nutrient delivery to foot tissues, and helps prevent the sensation of heavy, tired legs that many older adults experience. The beauty of Ashikubi pumping is that it requires nothing more than moving your ankles while seated in any position, or no special equipment, no need for elevation, and no dedicated exercise time. Even better, it combines circulation enhancement with joint mobility. Each pump movement becomes an opportunity to maintain ankle flexibility while simultaneously boosting blood flow. And here's a hidden bonus. The daily practice of ankle pumping throughout the day creates multiple circulation reset moments, essentially preventing fluid from accumulating in the first place. Many Japanese elders perform gentle ankle pumping during every seated activity, from meals to television watching to reading, creating a preventive approach that's far more effective than trying to reduce swelling after it's already occurred. So, while it may look trivial to untrained eyes, this rhythmic ankle movement is working behind the scenes to maintain proper fluid balance in your lower extremities hour after hour. Exercise 2: Sokudai pressure point. The reflexology-inspired technique that unblocks lymphatic flow. You've probably pressed on your feet when they feel uncomfortable, but did you know that a specific Japanese pressure point technique, called Sokudai, can significantly improve lymphatic drainage and reduce swelling better than compression socks? According to a study published in the International Journal of Lymphology, Adults who applied precise pressure to key foot points showed measurable reductions in foot volume and improved lymph flow after just 6 minutes of self-treatment. But here's the twist. It's not just about pressing randomly. It's about what happens in your lymphatic system during those targeted pressure applications. So Kudai pressure point technique engages the initial lymphatic vessels, lymph collectors, and lymph nodes that control fluid balance in your lower extremities. These crucial components of your fluid management system often become less efficient with age, which explains why many older adults experience increased foot swelling even without medical conditions. But here's what most people miss. The sequence and pressure rhythm matter tremendously. In traditional Kudai practice, you don't just press firmly on uncomfortable areas. Instead, you follow a specific path that mirrors the natural flow of lymphatic fluid, working from the toes toward the ankle and applying gentle, pulsing pressure rather than sustained pushing. This technique creates what Japanese practitioners call lymphatic pumping waves that help move stagnant fluid through congested tissues. Even better, according to research from Osaka University's Department of Integrative Medicine, stimulating specific foot reflex points increases circulation not just locally but throughout the entire leg, helping prevent the evening swelling that many older adults experience after a day of activity. So, forget expensive compression garments. Your fingertips are your medicine for improved fluid balance. And if you practice while watching television or reading, it becomes a comfortable therapy for your feet that requires no special time or equipment.